Hi, my chosen topic for this assignment is PTSD, or post-traumatic stress disorder. It's a mental health condition that's triggered by a traumatic event that then causes a series of events to cause you to mentally and physically experience the event. So, about out of 100 people, about 7 to 8 people at any given time in the population, at least in the US population, have PTSD. I say at any given time because PTSD can come and go. PTSD can also return for people who have had it before. Women tend to develop PTSD more than men do. 4 out of every 100 men do, versus 10 out of every 100 women. So the symptoms to PTSD are exactly that. Somebody experiences a traumatic event that causes them to have to relive it, which is one of the psychological symptoms, is reliving the experience. Feeling like they're constantly stressed out or paranoid, having flashbacks, or even upsetting dreams. Many people experience dreams that they feel like are very realistic, which is a lot like having a flashback while you're awake. So they wake up and feel like they were in the moment at that time. So, which leads us to some of the physical symptoms of that, which are just being easily frightened, being paranoid, being always on guard, kind of stiffened and stressed all the time. A lot of times some of those symptoms can cause somebody to do reckless things, meaning that they're angry or self-destructive, like their paranoia or their fear or the stress and anxiety of it all will cause them to, maybe drive too fast or drink too much or use some sort of substance. They also have trouble sleeping, irritability, have aggressive behavior, aggressive tendencies to things that for most people wouldn't cause an aggressive behavior or an aggressive reaction. The diagnosis of this is kind of hard. According to the DSM criteria, you have to meet certain things in order for this to be considered PTSD. One of those, going back to what I said before, that PTSD can come and go, is that PTSD has to be, you have to have had this for at minimum a month for it to be considered PTSD, which is kind of one of the things that separates it from you just having a traumatic event that you spent your time grieving over or spent your time getting over, which is a natural amount of time. It's when it goes past that 1 month mark and it's still causing you those psychological and physical symptoms that it becomes PTSD. But it's not just a matter of time, it also has to meet the criteria of it being a stressor for you. It has to be an intrusion for you. It has to cause like negative altercations with your mood. It also has to alter or mess with your function, your ability to function throughout the day, which is why things like paranoia or being easily frightened or easily irritated are part of the symptoms. And then, of course, the last thing is that it cannot be due to medications or substances for it to be considered PTSD. And you have to meet all of those criteria for it to be considered PTSD. So in order to get that diagnosis, you would have to have gone to therapy for long enough for that doctor to be able to diagnose you with it and then treat it, which leads us into treatment. So treatment for this is normally therapy, and it's tons of different therapies. Cognitive therapy, or EMDR, which is eye movement and desensitization reprocessing, which is just like using a pulsating or like a back and forth motion or a left right motion to get you to talk about the process so that you can get over it, or so that they can help you process your thoughts. Exposure therapy would be something like making you kind of relive the same thing. It often happens with like a phobia that later turns into PTSD. So they make you expose yourself to that thing so that you are no longer feeling that when you are around it. For me personally, I think one of my favorite parts of studying PTSD is that at one point there was a study happening around the synthetic drug MDMA to try to treat PTSD. Unfortunately, that doesn't happen, or it's not happening as much as it should be, because MDMA can help people kind of shed their ego and allow them to speak freely about what happened to them. And the studies that have happened have really helped people. Most of those studies have been performed on war veterans. When on this drug, they are able to process their thoughts and feel safe when they speak. In some of the documentaries or stuff I watch, they kind of describe it as having a blanket of comfort around them. Now, it's not just given to them like as a take this 3 times a day. It's given to them once during a therapy session so that they're able to freely talk, rather than helping them process their thoughts and guiding them through the process. The MDMA kind of does that for them. So that's probably one of my favorite ways of that this has been studied and treated. So see, we've talked about that. The biology of it. So, you know, when I first started reading about this, I was like, well, there's no biology to this. It's just a traumatic event, which makes it simply environmental. But I did come across some studies saying that there are DNA variants with people. So the study was done at the University of San Diego, where they're studying that there is certain genetic factors to people that make you more predisposed to PTSD, which adds a biology factor to it. Which this is great, and the reason why this is so great is because we often see PTSD, especially in veterans or people with who have struggled with like rape or abuse of some sort. But in terms of like our veterans, we could almost kind of like test them prior to see if they're predisposed, so that maybe we can get ahead of this stuff. So I did find that very interesting that there is a biological factor in this. As a matter of fact, the study noted that Europeans and Africans tend to have PTSD or tend to be predisposed to it more than other races. And then of course there's the environmental side of things, which is exactly what PTSD is. It's an environmental thing that happens to you that causes this change in your mental health. Again, things like war, sexual abuse, violence, but it could also be something as simple as getting in a car accident. It could cause you to have PTSD getting behind the wheel one more time. Let's see. So, I guess the conclusion to this is that I wish that people knew a little bit more about this and gave themselves a little more credit. I think most people can say that they've experienced a traumatic event in their lives and can relate to at least that piece of it. But having to relive that over and over is horrific. And that's something that I definitely can relate to. So I think that's a lot of why I chose this, is to try to get that message out there a little bit more. So what I've learned from mental health issues, I think it's important for mental health issues to be something that's talked about all the time. I find it baffling that this day and age, we don't see mental health as something normal. And it should be just as normal as going to your PCP for a checkup. Unfortunately, it isn't. So for me, what I've learned from this course is how natural and how normal it is for people to have some sort of small or large mental issues. And I wish that they were just more talked about. What will I do with the information I know? I think exactly that. I think my job, having this knowledge, is to maybe spread the word and let people know and help create that, or rather recreate the stigma around mental health. In terms of my degree, I think it's important to know that there's not only patients with this, but that the people who work for you or end up working for you are also going to go through traumatic events in their lives. And I think it's important for us to understand that everyone is human and to find some sort of compassion, not just for your patients, but for your employees as well.